Kesehatan Usia Produktif dan Lansia Kemenkes dan tengah menjalankan tugas belajar melalui program Euro Public Health.
Perkenalkan, nama saya Fahmi Adimara, FKM Angkatan 2010, saat ini bekerja di PT Arkan Mahika Indonesia sebagai Direktur.
Halo, perkenalkan nama saya Tiara, saya Angkatan FKM Undik di tahun 2011 dan saya Angkatan 14MM di Promosi Kesehatan dan saya melanjutkan pendidikan saya di Far Eastern Federal University di negara Rusia dan saya sekarang bekerja di Rumah Sakit Polri.
Ingin sukses seperti mereka, kamu harus mempunyai kompetensi sebagai berikut. Fasilitasi, advokasi, bina suasana, komunikasi, teknologi media promosi kesehatan, socio-cultural entrepreneurship, social media health content, pemberdayaan masyarakat, need assessment, dan juga edukasi hingga evaluasi program perubahan perilaku. Dari kompetensi-kompetensi tersebut, di PKIP kita akan belajar apa aja ya? Let's check this out. Nah, kita akan belajar di kelas dengan kegiatan diskusi dua arah bersama dosen yang kompeten di bidangnya. Praktikum di laboratorium AFA yang menggunakan peralatan yang canggih dan juga ter-up-to-date, sehingga bisa meningkatkan kompetensi mahasiswa dalam bidang teknologi media promosi kesehatan. Selain itu, kita juga memiliki kegiatan di luar kampus dengan terjun langsung ke masyarakat seperti KKN, KKL, dan juga magang. Ditambah lagi dengan kegiatan mahasiswa seperti GoPro, HPFest, dan juga kegiatan-kegiatan yang lainnya. Yang lebih membanggakan lagi, tahun 2022 PKIP banyak sekali meraih prestasi loh. Seperti juara 2 lomba video dalam Festival Kreatif Mahasiswa Tingkat Nasional, Gold Medal ICDC dalam rangkaian Tanato Student Research Award, juara 1 di Nus Potolog ke-7 Podcast Tingkat Nasional, juara 1 Lomba Penyuluhan Peringatan Hari Kesehatan Nasional dan HIV/AIDS tingkat nasional, dan juga ikut berkontribusi dalam PSM Undip dan meraih Gold Medal B pada International Brawijaya Choir Festival ke-10. Yuk kenalan dengan pengajar dan juga tenaga pendidik yang ada di bagian PKIP. Ada Ibu Aditya Kosumawati SKM MKes sebagai Ketua Bagian PKIP, Ibu Dr. Gigi Zaro Shaluhia MPH PhD, Bapak Dr. Bagus Wijanarko MPH MA, Bapak Dr. Andes Syamsul Huda Budi Mustafa MKes, Bapak Priyadi Nugraha Prabamurti SKM MKes, Bapak Besar Tirto Husodo Esos MKes, Ibu Rati Indreswari SKM MKes, dan Ibu Novia Handayani SKM MA MKes. PKIP juga dibantu oleh Pranata Laboratorium AFA, yaitu Bapak Teguh Wibowo AMD, dan juga tenaga kependidikan yaitu Bapak Ahmad Holil.
Apakah faktanya dosen di PKIP itu galak-galak ya? Bukan, mitos itu. Cerita itu mitos dong. Dan katanya juga nggak deket sama mahasiswa. mahal banget itu. Faktanya, dosen yang ada di PKIP sangat komunikatif dan juga terbuka loh sama mahasiswanya. Gak segan juga untuk mengajak kita berdiskusi bersama. Hubungan antara dosen dan mahasiswanya juga deket tahu.
Iya, bahkan memotivasi mahasiswanya untuk lebih sukses.
Jadinya kita semua lebih semangat deh. Kalau lulusan PKIP hanya bekerja di puskesmas atau pegawai negeri, fakta atau mitos?
Loh, plus mitos.
Memiliki kompetensi yang mumpuni di bidang promosi kesehatan justru membuat alumni PKIP banyak berstatus sebagai bijak.
Nah, ada yang bekerja di rumah sakit sebagai konten kreator di bidang kesehatan, industri, LSM, dan bidang lainnya.
Oh gitu. Terus katanya di PKIP nanti kita akan belajar tentang masyarakat lebih dalam. Fakta atau mitos ya?
Pasti fakta kalau ini mah. Buat betul sekali.
Rancangan intervensi perubahan perilaku yang efektif kan perlu paham masalah dan karakteristik masyarakat masing-masing.
Soal syarat masuk PKIP, emang harus pandai public speaking ya?
Tidak, mitos banget itu. Faktanya, syarat masuk PKIP hanya berdasarkan nilai dan wawancara. Udah, yang penting niat belajar aja. Justru di pemerintahan PKIP, kita banyak berlatih tentang public speaking, jadi jangan khawatir.
Verbal, vokal, dan juga visual akan banyak banget diasah di PKIP loh.
Wow, tapi katanya syarat seleksi PKIP lainnya harus bisa teknologi tinggi ya? Mitos atau fakta ya? Ih, itu juga mitos.
Faktanya kita di PKIP akan belajar mata kuliah teknologi PKM dan praktikum di laboratorium AFA.
Udah, nggak perlu khawatir lagi. Tentunya di PKIP kamu akan meningkatkan kapasitasmu terutama dalam bidang teknologi media promosi kesehatan dan juga akan sangat mendukungmu untuk menguasai segala kompetensi yang ada di bidang promkes tentunya.
Jadi, tunggu apa lagi? Ayo bergabung bersama kami di Peminatan Promosi Kesehatan dan Ilmu Perilaku. Health Promotion! Change the world!
Selamat sore, Bu Tina.
Halo, hai.
Halo, Bu Tina. Bu Novia, bisa kita mulai ya, Bu? Oke. Bu Win, selamat sore, Bu Win. Mohon izin untuk memulai, Bu Win.
Bisa dimulai, silakan. Good afternoon, Mrs. Tina, sorry.
Hi, good afternoon.
Good afternoon. Bisa dimulai, Mbak. Silakan, Mbak Aditya.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. To the Honorable Dean of Public Health, Universitas Diponegoro, which will be represented by the Vice Dean for Academic and Students Affairs, Dr. Sri Winarni, MPH. Head of Health Promotion and Behavioral Sciences Department, Ibu Aditya Kusumawati. Today's speaker, UNAIDS Country Director, Ethiopia, Ritayawan Tina Bonto. Today's moderator, Ibu Novia Handayani. Lecturers of Public Health Universitas Diponegoro, and all of the participants of this visiting lecture. Welcome to the visiting lecture, Confronting HIV, Challenges and Strategic Solutions for Effective Response. On behalf of the committee, I would like to extend a warm welcome and express our gratitude for participating in today's visiting lecture. My name is Erika, and I will be your master of ceremony for this event. Before we begin our agenda, let us pray together. Prayer begins. Prayer ends. Dear ladies and gentlemen, let us start our agenda with a report speech from the head of Health Promotion and Behavioral Sciences Department to Ibu Aditya Kusumawati. The screen is yours.
Okay, thank you, Erika. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Salam warahmatullahi.
Okay, good afternoon, everyone. On behalf, I would like to extend a warm welcome to Honorable Vice Dean for Academic and Student Affairs, Faculty of Public Health, Universitas Diponegoro, Dr. Sri Winarni, and all of you attending our webinar visiting lecture titled Confronting HIV, Challenges and Strategic Solution for Effective Response. Okay, today we are fortunate to have several esteemed speakers. Ibu Kritayawan Tina Bonto. Good afternoon, Mrs. Tina. And Mrs. Tina will share her insight on confronting HIV, especially in challenges and strategic solution for effective response. And we believe her expertise will provide us with valuable perspective and foster meaningful discussion. Buin and Butina, the participant joining us today is including professional, student, and experts from various fields, especially in health promotion and behavioral science. And your presence signifies the collective interest in challenge of implementing HIV program and strategic solution in HIV program. And we appreciate you taking the time with us today. Before we begin, I'd like to take a moment to thank everyone involved in organizing this seminar. We are looking forward to an engaging and insightful session that makes the most of our time together. And for the last, in our jargon, I will say health promotion. Change the world. Okay, thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Ladies and gentlemen, it is time for a welcoming speech from the Dean of Public Health Faculty, which will be represented by the Vice Dean for Academic and Students Affairs. Please join me in the warm welcome for Dr. Sri Winarni, MPH. The screen is yours.
Terima kasih Mbak Ensi. Selamat siang, good afternoon, ladies and gentlemen. I'm sorry, can we an Indonesian version? Terima kasih. Selamat sore. Assalamualaikum warahmatullahi wabarakatuh. Ya, terima kasih. Mohon maaf, Pak Dekan tidak bisa memberikan pembukaan sambutan karena beliau ada agenda yang berbarengan dengan acara ini. Jadi meminta saya untuk mewakili memberikan sambutan di visiting professor peminatan promosi kesehatan, gitu ya. Dengan tema Confronting HIV, Challenge and Strategic Solution for Effective. And thank you very much, Mrs. Kristiawan Brunto, from Unites Ethiopia from Thailand, yes, Miss. And I would like to show very much, thank you very much to Mrs. for being a speaker on the visiting professor activity. And thank you, thank you. Oke, kembali ke permasalahan HIV, kita tahu bahwa HIV kejadiannya juga semakin meningkat dan terima kasih untuk Bu Aditya dengan waktunya yang meluangkan di waktu-waktu yang mepet ini sudah meningkatkan capaian IKU dengan adanya visiting professor kegiatan ini sehingga meningkatkan capaian IKU untuk apa namanya target dari FKM dan kita tahu bahwa dengan adanya apa namanya ya kegiatan ini anak-anak kita anak-anak FKM juga akan semakin terpapar bahwa memang perlu ada suatu strategi khusus untuk meningkatkan pengetahuan mereka karena kita tahu bahwa kejadian HIV/AIDS makin meningkat dan ini juga diiringi dengan penyakit-penyakit yang lain gitu ya. Apalagi dan kita tahu bahwa HIV/AIDS ini kan penyakit viral yang memang pengobatannya belum ini ya, belum signifikan juga untuk menurunkan. Memang ada ARV, tapi kan ini belum bukan sebagai gold standard untuk pengobatan. Dia hanya meningkatkan CD4-nya begitu. Sehingga perlu adanya suatu upaya untuk mengakhiri epidemi HIV ini sehingga bisa menjadi apa istilahnya ya zero kalau bisa ya zero new infection dan adanya ada kegiatan penjangkauan rujukan tes HIV dan pemeriksaan IMS ini akan bisa meningkatkan apa istilahnya program lah capaian program gitu sehingga bisa menjadi Indonesia yang lebih baik gitu. Oke, mungkin demikian. Terima kasih kepada seluruh panitia. Semoga sukses acaranya sampai sore. Ini mohon maaf ya, saya buru-buru juga karena juga ada kebetulan agenda yang bersamaan. Dan saya kembalikan terima kasih kepada thank you very much Ibu Tina Bunto. Thank you. You're coming in Indonesia with Zoom, not offline in Semarang. Oke. Oke, thank you very much. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh. Selamat sore. Saya kembalikan ke MC.
To commemorate this event, we would like to capture a virtual group photo with all the participants. Kindly enable your cameras and show your best smile. I will help with the counting. Say cheese in 3, 2, 1. Three, two, 1. Now that we've had a chance to settle in, let's delve into the main session, which will be fully guided by our moderator. Our moderator for today is Ibu Novia Handayani, a lecturer of Health Promotion and Behavioral Sciences Department, Public Health Universitas Diponegoro. Please join me in the warm welcome for Ibu Novia Handayani. The screen is yours.
Oke, mungkin Mbak MC, mohon maaf, Bu Novia, saya undur diri dulu ya.
Yes, matur nuwun sangat Bu Win. Thank you very much.
Terima kasih.
Matur suwun sangat Bu Win.
Sama-sama.
Okay, and thank you very much, Erika, for being the MC for today's session. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen, to all participants. The Honorable Vice Dean for Academic and Student Affairs, Dr. Sriwinarni MKes, and the Honorable Head of the Health Promotion and Behavioral Sciences, Faculty of Public Health Universitas Diponegoro, Ibu Dita, and the honorable lecturers from Health Promotion and Behavioral Sciences. We have Bu Zahra, Prof. Zahra here. Good afternoon, Prof. Zahra. And also Pak Priyadi. Good afternoon, Pak Priyadi. And to all of today's participants, thank you very much for joining our seminar, Confronting HIV Challenges and Strategic Solutions for Effective Response. Today, we address the ongoing battle against HIV, a public health issue that continues to pose significant challenges worldwide. Despite advancements in the treatment and also prevention, barriers such as stigma, discrimination, limited healthcare access, and socioeconomic disparities hinder effective responses. Our goal is to shed light on these challenges and explore innovative strategies that can enhance our collective efforts. In this seminar, we will talk about many things in fighting against HIV strategies that will be delivered by our outstanding speaker. But before we give the chance for our outstanding speaker, let me read the rules for today's session. So first of all, to our online participant, please kindly make sure that your microphone is off unless the committee gives you permission to turn it on. Second, should you have any question to our speakers, please type it in the chat feature and don't forget to write down your name and your institution as well. And then about the presence link, we will share it in the discussion session. So now let me read briefly about our speaker CV. So she is Mrs. Tina Bonto from the UNAIDS Country Director of Ethiopia. Her aim is to contribute the global efforts to improve public health, promote good governance, and achieve international health and development goals. She has strong skills in program management, provision of technical support in planning, implementation, management, and resource mobilization, and working with the government and civil society partners. She has over 17 years of experience working in HIV, wow, amazing, 17 years, and other social development issues with 13 years in Asia, Indonesia, Myanmar, and also Thailand, and 7 years in Geneva, Switzerland. She can speak 4 languages, Thai language, French, English, and also Bahasa Indonesia. She has been working in UNAIDS for 26 years, 2 months. From being the country director in Indonesia since 2017 until last months ago, I think, and then in the UNAIDS of Geneva area, Switzerland, and UNAIDS Myanmar, and now she is in the Ethiopia. So let's give it up to Mrs. Tina Bonto. Good afternoon, Bu Tina.
Hello, good afternoon.
Good afternoon. The screen is yours.
Okay, now is my turn to speak?
Yes.
Yes. Okay, thank you. So first of all, I have moved from Indonesia, I think it was a month and a little bit ago. I think it was on the 8th of September, so I'm still very new in Ethiopia. But so immediately I got this invitation from Ibu Aditya,
Yes.
and and I said, but I have left Indonesia. Why are you still asking me to speak? And she said, well, yeah, even though you've left, you still can share your experience with Indonesia. And of course,
Yes, that's right.
My family is, I'm considering myself honorary Indonesian because my husband and my daughter, they're both Indonesian. And so, so I will, of course, have to say yes if Indonesia asks me to speak. But thank you very much for inviting me to speak. And really, this is something very exciting to have this visiting lecture to focus on promoting health and behavior and learning about positive health promotion behaviors. So this is something very, very close to my heart. And today we'll be talking about HIV, which is, I think I've worked on HIV even more than the 17 years. I think, I think I was 22. And then I started already working on HIV. Now I'm 52. So it's a long time, right? So now you know all my secrets. So the topic today is really confronting HIV. What are the challenges? And more importantly, apart from the challenges, what are the effective solutions, strategic solutions for effective response? So really, is AIDS over? If we listen to the news or by what we hear in social media or the news or among us, when we talk, we don't really talk about AIDS anymore. It's as if it's over. It's as if it doesn't exist. It's as if, we've done everything that we possibly could, and then there's nothing to do anymore. But HIV has been around for 40 years, and unfortunately, nobody has been able to declare that it's the end of AIDS. Countries are moving. Some countries are closer than others to achieve the 95. But many countries are still struggling. Out of the over 100 countries in the world, I think there's only around 20 countries that are close, that are already achieved 95 or close to achieving. Still, more than 80% are still struggling to get to that goal. Having said that, it's not as if it's all doom and gloom. Over the 40 years, there's been a lot of progress. And you can see also some of you may have already visited our UNAIDS office in Jakarta. We have an exhibition documenting the 40 years of AIDS around the world, but also local action in Indonesia, what has been done to try to, respond to HIV. So you can have a look at this exhibition on the history of AIDS and the responses in Indonesia. It's in Jakarta. So 40 years, we have some progress. We have seen that at the start, we thought that it would not be possible to provide ARVs, the antiretroviral drugs to many people, but now we have 31 million people on ARV treatment. This is out of the estimated 40 million people that are living with HIV. So while this is at 80% globally, 80% of all people living with HIV in the world are accessing ARVs, this means 20% or 9 million people are still left out and not accessing treatment. So what will happen to these people who are not accessing treatment? And you may not know, but if you're not on treatment, then your immune system becomes, the virus will attack the immune system. The immune system will be weak, and you will then get sick. It's not really the AIDS sickness, but it's a sickness called opportunistic infections. It could be TB. In Indonesia, TB is ranking, the second highest burden in the world. And so most likely, if HIV is not suppressed, then your immune will be weak and you will be susceptible to other illnesses, and TB is the #1 candidate. And then, so this is a bit a worry, a concern that AIDS is not over. There's still 9 million people around the world that are not accessing treatment. And also, when we look at the new infections, this is, I'll talk a little bit about this later on, but the new infections, the incidence, the annual incidence is how we measure whether a country or a location is achieving epidemic control, right? Globally, new infections is still at 1.3 million in 1 year. In 2023, we have 1.3 million new infections. To get to epidemic control worldwide, we have to have a number that is below 370,000, right? So 370,000, 1 million is still a long way to go. So as I said, it's not over. Many issues remain unresolved, but I'm going to highlight a few of them. So the first major issue is that new infections continue to occur because we do not have an effective HIV vaccine, and we have not been able to completely eliminate HIV virus from the body once it's already infected a person. And the new infections are occurring particularly among women and girls and children, right? This continues, we continue to see new infections among this group, which is very concerning. And the second major issue that is unresolved is the stigma and discrimination towards vulnerable and at-risk population. These are key populations that are at higher risk for HIV infection. So this is still occurring, and particularly for young people, because I was mentioning the young people are contributing to the new infections. When there's stigma and discrimination, young people will hide, young people will be afraid to seek information and access services. Inequality and inequity is another major area. With the existence of inequality, there is among different groups of people, lower income or marginalized groups. This limits the full access to comprehensive HIV and social support services, which then in turn, delays the achievement of the global 95-95-95. So coming back to this epidemic control, as you are, university students and studying public health, you will appreciate this this criteria for trying to determine when do we reach epidemic control. UNAIDS provides a guiding criteria, percentage reduction in incidence over time, again, the new infection, ratio of incidence to mortality, ratio of incidence to prevalence, and the last one being the annual incidence. So for example, in Indonesia, as of last year, there's an estimated 571,000 people living with HIV. And then the number for the annual incidence is 27,600. And the death, the AIDS-related death, is 27,300. So following the criteria that I just mentioned, for Indonesia to reach HIV epidemic control, annual incidence must be below 90% or less than 2,460. So if we remember the global number, it's 1.3 million. It has to be under 370,000. In Indonesia, the number was 27,600 new infections. Each year, it should be less than 2,460, right? So we're still a long way to go in Indonesia to achieve epidemic control. And when you see the number of deaths, which is also around 27,000 people dying of AIDS-related death, this is not a low number. So it means people are not on ARVs. It means, or they started ARVs and then they drop out, or, a host of other problems that present us with challenges in order to reach this level of epidemic control and be able to then end AIDS by 2030. So given this that I've mentioned, we can conclude that we're still not close to the goal. But it is a pity, it is really sad that while we're not close to the goal, the public has already lost attention on HIV, right? As I said in the beginning, we don't talk about AIDS anymore. It doesn't even get high-profile news coverage, even during World AIDS Day. I don't know if you know, when is World AIDS Day? You know, it's the 1st of December every year. And so this is our hope that in at least one day a year, we hear about AIDS and we gather the momentum to talk about this. And so, you know, but it is also in a way understandable because the world has so many other problems with COVID, messing up the whole health infrastructure, and the countries need to provide pandemic, preparedness and recovery and all of that. There's also conflicts around the world. Climate change is really a big concern, and all these problems that humans face also result in a very big problem, which is migration. People moving around due to necessity, due to war, due to climate change, due to the need to have economic opportunity. So it's no wonder that HIV is lost, under this this issue. But because of this less attention, we also see donors, what's the word? Yeah, going back on their words. They committed back in 2000 when we launched the Millennium Development Goals. They set up a fund called the Global Fund. They committed to fully fund the HIV response and get to the end of AIDS. But because of all these other competing priorities, they have reduced global funding for health and also for HIV. But indeed, as I have made the case, we're not there yet. We have not reached the goal, and so it is really premature to stop working on HIV and to think that we can go to sleep at night and this will be over. So we must still work hard to get to that level of less than 2,400 people newly infected in Indonesia, to make sure that the vulnerable groups are not continuing to be affected and infected. So we also need to, when we talk about reaching the end of AIDS, it's not counting those numbers alone, but we also have to see that the systems need to be in place, because don't forget that it's not only stopping the new infection. In Indonesia, as I mentioned, there's 570,000 people living with HIV. They are living with HIV, and for the time being, there's no cure. We cannot get rid of HIV from the body. We can suppress it. We can, provide ARVs, and people can, achieve a good status, health status. But still, those 500,000 people will continue to need the system, will continue to have to take ARVs as long as they live. But hopefully we will see technology to be able to, get rid of HIV from the body in the near future, but so far not yet. So I'm going to go into strategic solutions and how do we accelerate towards the goal of ending AIDS, which is it should be by 2030, which is when we count. This is less than 6 years now. And when we learn from countries that have succeeded, where they have 95% of the people knowing their status, meaning that they have gone for a test, they've received the test result. Of those who know their status and are positive, they are receiving treatment, this ARV treatment, And then of those on treatment, 95% of those on treatment do the HIV viral load test and determine that they are virally suppressed, which would then lead to, if 95% of the people on ARVs are virally suppressed, this would mean that they are undetected, their viral load is undetectable, and they will then achieve untransmittable status, which is a big deal, because this is why we want to make sure everyone tests early. If they're HIV positive, they're on treatment early, because this would mean that we would benefit from treatment as prevention. It means that those who are virally suppressed, they are not transmitting HIV onwards to other people. So those countries that have managed to be successful, we see that the key factors of success is really that they embrace a public health and a rights-based approach. Yeah, they establish strong partnership between government and community organizations to tackle these challenges that are really specific for HIV. No other disease have specific challenges like HIV. For example, malaria. You know, we fight against the mosquitoes, right? The mosquitoes are our enemy. Okay, for HIV, you know, many people have judgmental attitude towards people who get HIV, and they are blamed for, you know, transmitting HIV and all that. And so we need to really support people living with HIV. That in the successful programs, this is really an approach that works best. Okay. So I'm gonna talk a little bit about the public health and human rights approach. Public health and human rights approach really requires that the governments tackle the HIV epidemic with effective, evidence-informed interventions that respects human rights of vulnerable and at-risk populations. In the early days, there were few effective HIV prevention methods. Condoms for unsafe sexual intercourse, and clean needles instead of sharing used needles among, say, people who inject drugs. I'm going to give a concrete example, and as the representative of the dean said, yes, indeed, I am from Thailand. I'm going to take an example from Thailand. Thailand was successful in the early days, really, with their 100% condom program. What was that? It was, you know, knowing what was going on, knowing where HIV infection was occurring. They targeted this mode of transmission, which was sexual transmission, and they decided to be very pragmatic about it and said, okay, we have to protect the HIV transmission from this mode of transmission, which was sex work. And so they launched a national policy to say, it was not to say, let's close down all the brothels, but it was to say, where there's sex occurring, those who are engaged in sex need to use condoms, okay? Because really in Thailand back then, in the mid-90s, they were seeing tens of thousands of people dying every day. Okay, it was a big deal, and so it was a national emergency. It was a crisis, and they launched that program, and they were able to get buy-in from the sex workers themselves, but the brothel owners and the clients of the sex workers to really engage in this program. And so they were able to bring down the number of new infections dramatically after only a few years. So that's one public health response that was human rights based, because they knew that it was not a punitive approach where they would punish the sex workers or eradicate, the brothels from existence. And so they just, made sure that the virus was prevented from transmission. Another success actually was in Indonesia, also towards the mid-90s and the early 2000s, where there was a lot of injecting drug use. People were injecting heroin in Indonesia. And we launched, together with the government, a program for harm reduction. And that meant that, again, instead of cracking down or, a war on drug approach, there was a public health program, which was, okay, let's reduce the harm that is coming from sharing contaminated needles. And so there was a program which include prevention of overdose, provision of clean needles to stop transmission of HIV and hepatitis C, and a whole bunch of other issues. And that was also effective in bringing down the number of infections among the people who inject drugs. So these are our two programs that were really public health and human rights based approach. So today, Thailand's HIV program is really well known for being community friendly and non-discriminatory. It really uses the latest scientific evidence also to expand the use of post-exposure prophylaxis and pre-exposure prophylaxis, PEP and PrEP, that we know of. And so to complement ongoing condom use, they also added this PEP and PrEP to make sure that we use the latest prevention technology to complement the full prevention program. So we call this a comprehensive prevention package that people can choose and maybe use both if they have a high-risk situation. And really by reducing and eliminating HIV discrimination and also normalizing HIV, Thailand has been able to encourage people to seek early HIV testing and treatment. And in Thailand, the percentage of people on ARV treatment is 82%, with 81% already achieving viral suppression. So they, in addition to being able to keep their new infections down, they are continuing to care for the cohort of people that are on treatment, and they are able to make this group have undetectable status, so that this group of people who are on ARVs will not transmit further on and increase the number of new infections. So that's really great. And by normalizing HIV, what I mean is, it's not exciting anymore to hear about, someone who lived with HIV. There's hardly any judgment attitude. You can go for an HIV test or a CD4 test or a viral, whatever test. In Bangkok, this can be done, in lunch hour, because there's so many different facilities across the city that people can do this very conveniently. And the other area that is really important to highlight in terms of effective solution is the role of community-led monitoring and community partnership. So from the very start of HIV epidemic 40 years ago, it was really clear that lack of information, stigma and discrimination, judgmental attitude, and fear, facilitated the spread of the virus, because people were scared to know of their HIV status. They may suspect that they have HIV, they started feeling sick, but they were really so scared to go to be labeled as someone living with HIV. And therefore they never got tested, and they showed up at the hospital, already very late, and the only future for them was death. And that was really, the image we have when we think about HIV back in 1980s, 1990s. Some of you may not have been born yet, but yeah, trust me, it was like that. And so to address that situation, the HIV movement, the HIV groups, again, if you go and see the history of AIDS exhibition in the UNAIDS office in Jakarta, you will see that there were NGOs, activists that were talking about, calling for HIV medicine, ARVs to be available, to be affordable, and to keep people alive, right? So many people were dying, and communities mobilized themselves to be the ones to provide peer outreach, to provide support, to bring people to test, to bring people to treatment. And this really was like the feature, like the very recognizable feature of a successful HIV response, because now when we go and ask, what made it successful, everybody would say, yeah, because we work closely with the community. Only the community will gain the trust, of the sex worker, of the drug users, of the men who have sex with men, which were really, really harshly criticized and judged for their behavior, but so they would never open up to anybody else apart from their friends and their own peers, and they felt secure on that. So we note that, we documented that, and we kept on supporting this this approach, and now fast forward to 40 years later, it remains, a key pillar and really a cornerstone of the strategy, the global AIDS strategy, that we must continue to push forward a community-led monitoring, community-led responses, because especially now that we're approaching the end of AIDS, with how do we reach this 9 million people, right? This community connection is going to be more important than ever, because it's really, we have to rely on the community that's going to bring those remaining people into treatment and support. So I want to go back to the example of Thailand. We see there that the government programs really work collaboratively with NGOs and CBOs. The community organizations that work for sex workers, young people, men who have sex with men, drug users, they provide support. These NGOs and CBOs provide support to their communities at some kind of a community care center. It's not exactly a community clinic, but it's a space where community members can come, get information, get support, get services. They even conduct the HIV test. They have mobile vans, and they can administer the HIV test. They provide counseling, mental health, therapy support, and they provide the post-exposure prophylaxis and the PrEP, as well as in case of the need of multi-month supply of ARVs for routine patients. Some community organizations can even provide that with approval from the public health sector. So in doing this, really the gain is it's everybody's gain. The Ministry of Health appreciates the community support, because it eases the burden and the strain on the healthcare workers. They may not have enough healthcare workers to care for all the people like this, because if you have healthcare workers who don't have time, you go in and then they give you blah, 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 and then you're supposed to understand everything, right? It's so with community health workers, community support team, you can talk and you can take your time, and you will be, you know, much more understanding of the importance of adherence, etc. So this is all, you know, a win-win scenario for everyone involved. Also, by allowing the NGOs and the CSOs to perform this role, it's also empowering and building the capacity of CSOs and NGOs so that Thailand now has a solid foundation for sustainability and resilience. So they have a functioning health system and community system that together they respond to this unique challenge of HIV. And we do see from the health financing side that Thailand is less reliant on external funding from donors. They have only very limited funding from the Global Fund, and they really support this whole national response that is multi-sectoral with the national budget, with domestic resources, and only very few components are, even the NGOs and the CBOs that we visited, we saw that they are fundraising for themselves. You know, they're able to ask funding from private sector, from the local embassies of, you know, whichever government to provide, for example, the mobile vans, and the equipment and training and things like that. So that's their creativity, but they're also proactive in going ahead and mobilizing resources for themselves. So that's the value when we allow the space for the community, when we, you know, build their capacity, we will be able to see that they're able to do so many things on their own and be part of the solution, rather than just wait, you know, for the government to do everything, which, you know, we can wait a long time because they have so much to do. Moving on, there's another area that I think is important, is really being quick to adapt the latest science and technology and to use digital solutions, including AI, right? And we will focus on the good parts of AI and the good parts of digital technology. But so again, going back to Thailand, another distinctive feature is their pragmatism. So they are very practical. They see a solution and they see a problem and they think about what are the solutions, right? And they will review the solutions. But the thing about Thailand is they quite quickly adopt solutions, maybe as pilot as pilot mostly. For example, when they launched the condom program, they were, you know, really thinking what would be the most effective solution, and they tried out with the condom, 100% condom program, and it really worked. Again, move forward to when PrEP was recommended as prevention prophylaxis, they were also very quick to take that on board and offer this to their at-risk population. And also I remember very early on they were having problems with eliminating vertical transmission from parent to child. And they were the first to really conduct, you know, medical research on what would be the best approach to work with pregnant women who are HIV positive to come up with, you know, this prophylaxis and mother to child transmission intervention, the prevention intervention. Really, Thailand was ahead in going into trials of how to really provide ARVs as prophylaxis to pregnant women, even before we talked about PrEP. Yeah. So and then now we see the result of their success. It's a they're the first in Asia to declare successful elimination of vertical transmission. So this is really a feature of seeking knowledge, seeking conducting research to try to solve this challenge that they face, and it really paid off. Another area, and they are of course in vaccine development and HIV vaccine development and working on various ARV regimen. Thailand is a leader in the region to be always in control trials and everything to try to find out what would be like to be able to get the vaccine for the region. And then also we have talked about technology, again, in tracking community and client feedback. They have established a multi-sectoral committee to track and monitor user feedback, patient feedback. So we saw that anyone who went into any clinic, be it NGO clinic or government clinic, they can scan the QR code and provide a compliment or a complaint, and the multi-sectoral entity commits to respond to those complaints in a limited time frame, and that has really been something that is well used, and the community also gained the trust of the community, and so they also then actively provide feedback into that channel, because they know that the response, the reply, the complaint or the suggestion will be seriously taken into consideration, and they can actually see improvement and change after they submitted those suggestions. And in Indonesia, and hopefully you have heard about Tanya Marlo, but UNAIDS, launched the use of AI-powered chatbot to provide information to young people about HIV, and also not only provide information, but would connect people who are looking for HIV testing, mental health support, or I think also PrEP. Tanya Marlo will connect you with all of that, and so that has been something that we are very proud to have been able to share, and it is now managed by YKIS and a community organization, and I think they have expanded it. It first started out for Jakarta, but now I think it's anyone wherever you are can access this, and we have received feedback from some users of Marlo that it has been really game-changing in a way that young people can access this information without fear of being found out, that they're asking about HIV, that they're asking where they can get PrEP. So it has really made a big difference. So this is what I mean when whatever technology is available, we should be quicker to embrace that and to use it, and to help us facilitate our work. It's not like 30 years ago where all this technology didn't exist. 30 years ago, people taking ARVs, again, you haven't seen this, but because you're very young, people had to take 30, 40 pills a day, right? And they were very toxic, but that was the only thing to do, because if you want to live, you had to do that. Now, we're talking about 1 pill a day. It's not toxic. It's much better than what it was before. And in the near future, if you follow HIV news, we will have injectable version, long-acting injectable ARVs, which you can inject 2 times a year, and that's it. And hopefully this will be affordable soon, and it would be available for use wherever we need it. I mean, imagine instead of taking a pill every day, you just go to your doctor twice a year. It will change so much. It will improve really the quality of life, because there's still a burden of taking medicine once a day. You might forget, you might not want to be seen taking the pill. You know, it's boring, you know, you feel tired. So anyway, the technology and science is catching up, and hopefully, you know, one day we will even see effective treatment that will even get rid of HIV. But in the meantime, whatever we have, we should use it in order to really accelerate our progress. And then my almost last point, I see like the moderator is kind of going on and off the camera. But my almost last point is young people. Really, young people are the key. You know, when we look at the trends of the new infections, we are really sad to see that a large proportion of new infections are occurring among young people in Indonesia. And, you know, many of you have heard me speak about Indonesia. Of the 27,600 people who are newly infected last year, 50% are young people under 25 years old. So, you know, when you do the math, what is that? 14,000 people, young people under 25. And, you know, I was in Bandung and Jakarta and different places to look at the numbers from the puskesmas and the clinics. They're really reporting those in terms of real numbers. There are hundreds of people in each puskesmas that are 13, 14 coming for ARVs, right? So when did they get HIV? So this is happening. You cannot close your eyes to say that, you know, young people don't have sex, you know, or, you know, don't do anything to get HIV. And I'm talking about young people, not the ones that are getting from parents, you know, from the vertical transmission. These are young people that are getting this from, you know, unprotected sex. And yeah, so we are really concerned that this is happening, and especially now, we know HIV is preventable. We know that if we give timely information, if we give sexual reproductive health education, if we promote the delaying of, you know, initiation of sexual intercourse, or if it's not possible to delay sex, then you know, the use of condoms or PrEP to those who are, you know, at high risk, this must be made available. Also, in the same way that community outreach programs have been, you know, the cornerstone of success, if we're seeing that this is occurring among young people, so the programs must be led and provided by young people, right? So, I mean, it just doesn't work for me to go tell a young person what to do, because they will never listen to me. I know this from experience. My 12-year-old never listens to me, right? So we need the young people to tell them. And like my daughter, I mean, if her friends tell her to do something, it's like, oh, immediately, you know. So this is something we have to promote this and empower community organizations of young people, that they are involved, that they are caring about HIV, that this is, you know, an issue for them. So spread the word that HIV is not over. Young people have to be involved, and really, it's the young people. They're the ones that are tech savvy. They're the ones that know how to create interesting content that will attract their other young people followers. Using TikTok, Instagram, or whatever. I'm only using Facebook. So you know, it's not getting to young people. And again, to just to use the right solution. And in this case, it has to be young people to make sure that the future of the next generation, of their generation, will be competent and knowledgeable in order to avoid HIV and to make the right choices. So I'm concluding now that even though we are closer today than ever, you know, to reach the goal of ending AIDS, it's that last mile that can be really the most difficult, the last 9 million people and these young people that need to be, you know, prevented from getting HIV. How do we reach that group, right? So this is like a homework for you. Think about this. What more must be done? It will require really extra effort. It will require, you know, social support, conducive environment, active encouragement, and not a punitive approach, not punishment, right? I don't know, I mean, talking about campaigns to stop people from smoking, if you say to them, oh gosh, you're gonna die early and blah, 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 your lungs are all gonna be black, that's not stopping people from smoking, right? We know that. And so, but other incentives like, you know, you're gonna be healthier, you're gonna look better, you're gonna, you know, look younger, not have wrinkles, you know, maybe that's going to be a selling point for people, for women to stop smoking. So we have to get the right messaging, we have to get the right strategy, and be smart about how, you know, we get to more people to join the cause, and but really make sure also that we don't leave any groups behind, because we tend to leave difficult issues behind because we don't want to work on difficult issues. But really getting to 2030 and trying to end AIDS, we're going to have to deal with the difficult issues, and this is where we have to be brave, we have to be bold, we have to really push and work together to make that happen. So thank you very much. I will end there, and I will take questions in Bahasa Indonesia, Bahasa Thai, apalagi ya, tetapi yeah, I think I will stick to English because I've left now for 1 month. I've forgotten my Indonesian. Thank you so much. Terima kasih.
Thank you so much, Butina. Very insightful. I think you won't forget Bahasa Indonesia in just 1 month. Just maybe you need a friend to talk about in Bahasa Indonesia. Okay, so talking about HIV, it is very interesting topic, and truthfully, I have so many things that I need to discuss with you. But first thing first, talking about the treatment, how close we are to the cure.
Yeah, unfortunately, we are not close to the cure. You know, we have seen the latest apalagi itu, the latest possibility was on a almost like a cancer treatment patient, and there were 3 of them. But this was a very complicated treatment and expensive, and that it happened almost by accident. While they were treating something, they realized that HIV kind of, you know, disappeared. But so that is not something that is easily replicable, you know, and repeatable. It would, and not not cost effective to pursue, right? It's very invasive. It's you know. So, however, really, this antiretroviral drug is the closest, and it has also been helpful for COVID, for others, you know. And so I think now, because it has been proven effective for so many other things, this technology of reversing the virus or slowing down the virus, that's what antiretroviral is. Trying to stop the virus from reproducing and then, you know, attacking. We saw one article that was saying that there might be a medicine that can trick the virus, you know, sort of like it can create something else, and that will stop the virus from, you know, existing. But anyway, all those are still in research stage, but we are hopeful that because it was so useful for other diseases, that the scientific community and the public health community, the global health community, will agree to push the pharmaceutical companies to advance and accelerate, you know, this research in order to come up with a cure. What I mentioned about the long-acting ARV that can be administered through injection, this is also a very huge advance, right? So if we have like immunization, these 2 times a year, or later on it would be 1 time a year, or later on it would be once every 5 years, you know, this is already very, very helpful. Right. And when we have suppressed level of the virus up until undetectable, it's almost like there's no virus you cannot see the virus in the body. It's there, but it's not active, right? So that's also jadi daripada kita fokus on cure, kita juga bisa appreciate, ya kan, bahwa ya ini bukan cure, tetapi ya it's not doing any harm gitu.
Right.
Jadi itu sih.
Okay. So now are we talking in bahasa? Okay, so I do agree with the injecting ARV, because talking about the compliance of our people, especially Indonesian people, there are so many factors that make them uncompliance to the ARV. So if it is possible and affordable, of course, I think it will be a very good idea for the new ARV. Okay, so we have so many comments on the comment section. We have the first question from Mr. Santoso Edi Budiono. So Indonesia is already successful talking about the harm reduction, but the condom program, it has so many pros and cons. So what do you think? How do we, accelerate the condom program in Indonesia?
Yeah. Itu mungkin kalau di court aku bisa bilang I refuse to answer that question gitu ya. No, tetapi ya sebenarnya nggak terlalu ini sih, cuman gini. Makanya kenapa kita dorong supaya ada pre-exposure prophylaxis, PrEP, which is a pill, ya kan? Kalau aku dengar dari orang Indonesia waktu kita diskusi soal PrEP, aku dapat info seperti ini. Kalau orang Indonesia sih kalau minum obat, minum vitamin, pergi ke klinik dapat injection, itu kayaknya lebih acceptable gitu loh. Jadi kalau orang sakit itu minum obat, ya kan biasa gitu. Yeah. Tapi kalau mau kasih kondom dan bilang ini buat prevention, ini buat bikin kamu lebih sehat, itu kayaknya ya nggak bisa ngerti gitu. Aneh gitu kan. Jadi ada pertanyaan banyak yang akan mulai, ya kan, itu kondom itu buat promotion, buat bikin nanti anak muda, orang muda lebih tertarik mau ada seks karena lihat cara pakai kondom, jadi gimana, atau kalau pakai kondom itu promote free sex, ya kan? I mean sebenarnya sex is never free ya. Jadi saya juga punya masalah dengan istilah free sex itu, nggak pernah free itu. Kita harus ada konsen, kita harus ada ya, agreement, kapan kita boleh, ya kan? Jadi kondom itu, makanya kenapa saya bilang bahwa contoh Thailand itu mereka ambil pragmatic approach. Pragmatic itu apa yang perlu kita lakukan itu aja. Tapi itu harus tidak against the law, ya kan? Itu tidak harm orang lain, ya kan? Bikin orang sakit. Tapi kalau solution itu implementable, oke, kita implement aja gitu loh. Nah, itu orang Thai itu walaupun mereka Buddhis dan mereka juga punya kamu nggak boleh punya lebih dari satu sexual partner kayak gitu kan. Ada juga semuanya, tetapi mereka tutup mata aja gitu loh bahwa sekarang nih ada epidemik dan kita tahu nih dari sini. Jadi kalau kita nggak bisa stop that behavior, akan walaupun mau tutup sex location di Chiang Rai misalnya, akan buka lagi di tempat lain atau tutup that physical location akan buka di online atau apa, orang akan cari solution buat mereka tetap lakukan itu kan. Jadi mereka bilang, oke, kita nggak bisa sweep this under the carpet, it will happen anyway. Daripada kita bilang kita tutup ini semua, nanti semua underground, kita nggak tahu mereka ada di mana. Mereka lebih prefer, mereka tahu orang ini ada di mana dan mereka datengin dan kasih kondom. Ya kan, dan wajib harus pakai kondom. Kalau nggak bisa, nggak boleh, dan akan ada spot checknya. Si location ini pakai atau enggak, pakai berapa, bla 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 gitu. Terus mereka coordinate sama si puskesmas di sana dan akan ada record kan, new infectionsnya increase atau decrease di daerah itu gitu. Jadi itu contoh government atau negara, bukan negara sih, contoh wilayah yang bisa lakukan program seperti itu tanpa political or social pressure atau judgment dari society. Jadi itu gampang gitu loh. Saya ngerti bahwa di Indonesia atau di sini di Ethiopia pun nggak bisa begitu juga gitu. Jadi bagaimana? Makanya kita bilang buat Indonesia itu oke, kondom kalau bisa, ya kan? Kalau bisa akses kondom, pakai kondom. Kalau perlu, mungkin nggak perlu juga kondom. Tapi kalau perlu pakai kondom. Kalau nggak bisa, sekarang ini ada PrEP, ya. In the worst case scenario, kalau high risk nggak bisa pakai kondom, pakailah PrEP gitu. Tapi idealnya walaupun sudah pakai PrEP, harus pakai kondom juga karena PrEP nggak prevent STI, nggak prevent pregnancy, ya kan? Yeah. Jadi kondom tetap sebenarnya menurut saya kondom paling bagus lah karena multi-purpose.
Betul.
Gitu.
Ya, kalau di Indonesia kondom banyak sekali yang kontra ya. Tadi terkait dengan apa ya, seperti mempromosikan seks bebas atau free sex tadi, tapi malah lokalisasi malah ditutup sampai akhirnya kita sendiri yang kebingungan mencari para sex workers-nya ini di mana gitu. Bahkan sekarang banyak yang lewat micet lah segala macam, jadi lebih susah ya untuk mengintervensi.
Iya.
Baik ya, itu masih menjadi tantangan kita ya. Kemudian,
sorry, balik lagi ke kondom. Jadi kalau bisa pakai kondom, Kalau nggak bisa, kan ada PrEP. ada lagi di fase research ya, kayak implementation research, tapi sudah siap buat pakai. Itu vaginal ring. Vaginal ring seperti contraceptive ring ya, yang masukin ke vaginanya, terus itu ring akan secrete ARV, yeah, that will also act like prevention prophylaxis, so like PrEP, but in a ring version. And then like when we had the ring for birth control, so you put the ring inside your vagina for it could be, I think, a month, and then you remove it and change every month like that. That is being piloted, and I think in Cambodia they're starting, and I'm not sure if Thailand they have started. And so it's also in line to be started in Indonesia, right? Now we were thinking that in for the case that condom is not readily available, or people cannot access condoms easily, maybe using the ring can be more discreet. So say the sex workers, for example, they can use this, they can get this and use this without too much of a problem gitu.
Ya, oke. Baik, apakah ada pertanyaan lain dari peserta? Kami persilahkan untuk raise hand. Oke, sudah ada Fatma Chandra. Ya, kami silahkan Fatma Chandra untuk bisa menyampaikan pertanyaannya.
Sudah boleh buka mic nggak dia?
Oh, iya, pengaturan host. Oke, sebentar.
Oke, sebelumnya suara saya masuk nggak ya, Bu?
Iya, sudah masuk.
Oke. Before of that, I would like to thank you for the opportunity and the knowledge that Miss Tina has been shared for us. And let me introduce myself first, Miss. My name is Fatma Chandra, as one of the student of Public Health Diponegoro University, majoring in health promotion and behavioral science. While explaining, you briefly explained how the condom use policy in Thailand and how it works. And I want to ask about that. The House of Representatives are usually called as DPR or Dewan Perwakilan Rakyat, recently criticized the condom policy for teenagers because it's considered that the policy actually supports sexual relations outside of marriage in a different way by using condom. It was also debated by several religious leaders because, as we know, Indonesia is a country of law as well as religion. How can the condom policy be before of that? I think it seems that before implementing a condom policy, we need to strengthen the sexual basis of education in Indonesia. Maybe you can share your experience, what the strategies and how the policy is condom policy or education, sexual education implemented in Thailand or other countries as well. Thank you.
Ya, silakan Bu Tina.
Okay, I can answer immediately. Yeah. So I that's a very good point that you raised. I think that back when the whole condom controversy was starting, and Indonesia is still going on about it now, but actually 20 years ago, many other countries were also against the promotion of condoms. So this reminds me of what they started to do, and it was also successful. It was in Uganda, yeah. Uganda, and don't forget that HIV affected Africa continent more than any parts in the world, and Uganda was one of the countries that had high number of people living with HIV, and so they were really faced with this dilemma of how are we going to stop the infections. And again, they saw that condoms was, affordable and effective, right? And so there were groups that were promoting condom use. But of course, they ran into the same resistance with the church, with the parents, with the government that had to listen to the church and had to listen to the parents. And so what they were able to do is to promote what they call the ABC, right? A being abstain from sex, for young people, abstain. And then if you don't abstain, then at least you be faithful, the B. And then if you cannot be faithful, then you use condoms, right? The ABC approach. And so I think this is also what you were saying, Padma, that this part about before you can get to the ABC, as a program, you would have to educate the young people, right? And so I think the first step here is really to bring into the school curriculum sexual education, reproductive health education in a way that is acceptable to the country, right? But you cannot beat around the bush because you must give the science, you must give the information. Without the information, you are actually putting young people at higher risk, right? Because we all know, and that is why we introduced Tanya Marlow in Indonesia, we all know that people go on the internet to find information, and what do they find on the internet? They actually don't find the right information, they find all the wrong information, right? And so the chances of finding the wrong information is higher than finding the right information. So you have to, that's why the education sector, the government needs to take that responsibility and educate the young people and give them the right information. And then there you can talk about ABCs, right? You're not gonna, the program, the condom program is never about, here you go, use condoms. It doesn't happen like that. It's just that people pick up the condom because, I don't know, maybe the advertisement from Durex or whatever is so sexy. And so people focus on that part and say, oh my God, they're distributing condoms, It's never about that. The condom program is always about, this is your last resort. But in the case that you are at your last resort, you should be always having access to condoms, right? I mean, nobody promotes that male or female go to sex work. Nobody promotes that,
Yeah.
And so, but from the public health and from the science point of view, if you're going to be in a situation where you have to use condoms and nothing else is going to protect you, you do pray to God or your government that you will be able to have condoms, right? That's the point. But I really appreciate your comment, Fatma, about sexual reproductive health education for young people is really non-negotiable. The condom thing is not as important as that education.
Agree so much. Talking about Tanya Marlow, I think it's a very great movement for the young people, especially for students at university. since I am a lecturer here, so I know a little bit that students in university, they are, what is it, like being exclusive. Jadi mereka mengeksklusifkan diri. So when they need to access the HIV test, they do not want anyone to know that they are accessing the HIV test. And also condom, when they are buying or looking for a condom, they do not want anyone to know that they are accessing condom. So I think Marlo is a very good way to educate young people, especially for the university students. Okay, so the second speaker, what is it? Penanya kedua ya. Jadi tiba-tiba lupa. Adin, silahkan bertanya. Adin, silahkan.
Iya, Bu.
Sorry, sorry Bu, maaf. Barusan ada gangguan izin on cam sebentar. Sebelumnya mohon maaf Ibu, saya boleh pakai bahasa Indonesia bertanya? Oke,
Ya,
terima
silakan.
kasih. Sebelumnya perkenalkan, saya Adin, saya dari mahasiswa FKM Undip 2022. Karena tadi kita udah bahas tentang banyak isi ya Bu ya, saya ingin bertanya terkait pekerja ini Bu, pelayanan kesehatan, kayak healthcare worker-nya itu. Jadi kayak gimana sih Bu terkait stigma yang muncul dari pekerja pelayan kesehatan. Jadi bukan dari masyarakat aja, tapi itu muncul dari pekerja pelayan kesehatan itu. Dan tentunya Ibu mempunyai banyak pengalaman sekali ya Bu. Dan menurut Ibu tuh apakah cuma di Indonesia atau gimana ya Bu? Itu ada, karena kan kadang ada beberapa negara yang mungkin beda gitu. Apakah itu hanya di kita atau di negara-negara lain juga ada bahwasanya diskriminasi itu muncul dari pekerja layanan kesehatan gitu. Mungkin itu dari saya. Terima kasih. Berkenan dijawab Ibu.
Terima kasih pertanyaannya Adin. Please,
Tolong ulang key points. Saya dengar nggak 100%.
Ya, tadi Adin bertanya bagaimana kondisi tentang stigma dan diskriminasi dari para dari layanan kesehatan itu sendiri, dari tenaga kesehatan di situasinya di negara lain mungkin. Karena itu masih terjadi di Indonesia.
Jadi betul sekali, bukan hanya Indonesia yang punya masalah ini, dan kalau dengar 3-0, kita selalu bilang 0 new infection, 0 death, 0 discrimination, ya. Nah, kenapa sampai 3 zeros gitu loh? Sebenarnya kita bisa berhenti di 0 new infection, 0 death, ya kan? Tetapi saking jadi masalah si discrimination ini harus masukin sebagai satu dari 3 ini poinnya gitu loh. Dan saya akan balik ke contoh Thailand lagi. Saya skip sebenarnya. Saya skip ke good part, ya. The good part was akhirnya sekarang pemerintah dan community punya collaboration yang bagus dan mereka punya sistem dan services yang friendly. Nah, jadi sedikit shortcut cerita ini, karena sebelum Thailand sukses dapat 80%, 81% people on treatment itu, mereka kena masalah juga. Jadi ada delay in achievement of target. Jadi dan mereka bilang, loh ini gimana? Kita nggak bisa lebih cepat punya dapat orang on treatment gitu kan, bikin orang pakai obat. Jadi mereka bikin assessment lagi kan, kenapa, ada masalah apa, terus dari situation assessment itu mereka ketahuan lah ada beberapa health facilities yang benar-benar ada discriminatory attitude gitu, dan karena itu orang nggak datang ke klinik dan nggak mau di lecture, nggak mau di judge kayak gitu kan. Jadi mereka bikin strategi, mereka identify di mana yang ada discrimination itu, terus mereka kasih training khusus. Training itu mungkin ada juga like involvement, participation dari community, dari key population. Training itu bikin orang kesehatan, tenaga kesehatan lebih paham keadaan orang atau human story-nya masing-masing gitu kan. Dan akhirnya setelah training mereka bikin kayak competition, puskesmas yang mana yang paling friendly gitu kan. Terus akhirnya, tapi ini jadi program besar nationwide juga, yang mereka bikin M&E training program to reduce discrimination, tetapi mereka ada M&E component juga. Jadi akan ada review, akan ada user feedback, dan akan ada designation dari bilanglah 500 puskesmas across the country. Tahun ini sudah ada 30 yang dapat certification friendly clinic, bla 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 gitu. Terus seperti itu. Nah sekarang karena mereka lakukan itu, mereka bisa lihat angkanya naik gitu kan. Terus sampai sekarang akhirnya mereka masukin komponen stigma dan discrimination sebagai main component in their HIV strategy. Makanya mereka punya isi multi-sector mechanism itu, dan ada QR code di setiap layanan supaya orang bisa kasih feedback. Kalau kena stigma discrimination akan ketahuan gitu loh. Terus, nah itu Thailand. Negara lain juga punya banyak, jadi karena semua orang kalau dapat information bahwa HIV ini bikin orang mati, orang akan takut gitu loh. Seperti COVID awal-awal, kita takut juga kan. Tapi, dan kenapa bikin balik lagi HIV ini spesial gitu loh, karena kalau COVID kan airborne atau TB airborne. Jadi siapa aja bisa transmit ke orang berikutnya gitu. Tetapi HIV itu karena hanya intimate behavior, intimate sex, dan atau injecting drugs or injection. Jadi bikin banyak stigma dan banyak blame-nya gitu loh. Ini pasti gara-gara kamu bukan orang yang bagus karena bla bla bla, akhirnya kamu jadi dapat HIV seperti itu. Jadi then the way to counter that actually is to actually be, again, to take this public health approach, right? To say, if we have this fear, we first explain to people the true situation. It is transmitted this way, this way, this way, this way, right? Some people forget and don't know the full information, think that, sharing water or, sitting next to each other or giving a hug can still pass HIV. That's not true. So we have to demystify some of these things. But also, if we give role models that are showing that, if someone is on treatment, they're not, and they have viral suppression, they're not transmitting this to another person, it's not so easy, to pass HIV on, so I think that's, again, the role of the health promotion, of the education, that needs to be updated regularly, because I personally, I think, like, we never hear about HIV anymore. So maybe maybe some of us like have the wrong information and it's never changed, you know, because we don't hear regularly about HIV. Many people I talk to in Indonesia, they didn't know that if people are on ARVs, that they are not, and their viral load is suppressed, that they are not transmitting this, that they can achieve undetectable status. People don't even know that the government is providing ARVs free for everyone who need it in Indonesia. People don't know that PrEP exists and what PrEP does, and that it's how many 90-something% effective. So yeah, I think giving information is going to be key to reducing stigma and discrimination. And for information, you know, Ministry of Health of Indonesia has already agreed to work on a similar training program like Thailand did, to ensure that the healthcare workers, the public health workers are not discriminating. And that so soon we will be seeing more centers that are certified as, you know, community friendly. And hopefully, and this does not only help HIV, you know, TB, HIV, others, hepatitis C. This can also help the other services.
Yes, thank you very much for the enlightenment because I heard so many stories about stigmas and discrimination from the health workers themselves to people living with HIV. And some stories came from the mother who delivered their babies and they got discriminated by the midwives themselves. Okay, so we have another question here about the ring. Is it the female condom? I think
yeah, it's not the female condom. The female condom was like maybe 15 years ago now. This is a new thing. I think the one who asked is a male.
Yes.
I'm not sure.
Yes.
Yeah. So the women can explain to him that there used to be, or maybe there still is, a birth control ring. You know, and this is the same idea as this birth control ring. So the ring is inserted into the vagina, and then this is there will be ARV secretion coming out of the ring, and this is the medication that provides prophylaxis, like PrEP, like oral PrEP. This is a ring form that is inserted into the female private part. And so the men don't try to insert that. So yeah, but it's not the female condom, because the female condom is only like a condom. It's only a thing that, you know, stops. It's like a sac that will then prevent, you know, things from going through. But this one is a ring that will stay inside, and the ring secretes this medicine that acts as the prophylaxis. I hope that's clear.
Does it also do the birth control? And maybe the...
very good question. It does not do that yet.
Oh, okay.
But this is one of the ideas, because they're a little bit, the chemical for birth control and the chemical for ARV is different, right? ARV, birth control, you can have that every month. ARV, if you are only preventing, you may not need this every month.
Yes.
So they're still trying to figure out the dosing of how much to put inside. And so, yeah, it's because also like with birth control, it was easier in that you put the ring in once a month and then you take it out. And as long as you're at risk of pregnancy, right, you will use it. A woman will use it every month. But the HIV prevention one is sort of like you don't always, you do not always need it, or you will not always be using it. And so they also think about that in terms of for the women
Yes.
to have a
I was
choice.
just,
Yeah.
yes, I was just thinking that maybe if it is 3-in-1, it will be a good
Yes,
idea.
yes. And many people who participated in the readiness research survey, they said that as well. It would be yeah, the 2-in-1, 3-in-1, that would be making life much easier. Yeah, yeah.
Right. Okay, so do we have another questions from the audience? Okay, I think that will be enough for our discussion. Bu Tina, do you have any closing statement?
No, I'm hopeful, I've worked a long time on this issue, but I'm hopeful, even though there are some major challenges like, members of parliament saying this or that, but I think that's why I end my note with I'm young people are the key, young people will look at this in a way that will find the solution, I think young people are smart, that they will not just take something like that, they will question, they will investigate, they will find the solution, this is true, this is not true, they will not just blindly listen to someone, so that's what I hope that when young people get involved, that they will be finding the strategies, finding the solutions, and helping the other young people in the next generation, because I have seen some amazing things, get solved and get done by young people. It's just that the system and the older people have to give way, have to give a chance, and maybe that's the one thing you can do, is ask for the technology, ask for all these things that will make it easier. You have that right. You are the young people of Indonesia. You are the future of Indonesia. You have that right to demand, from the government, sexual reproductive health education. Maybe you conduct research, get evidence, and you present this to Parliament, and you say, this is the situation. We cannot close our eyes to this issue. It's not about condoms, but it's about having options, right? What are the options, right? I mean, if the option in Indonesia is only condom or HIV, will the members of parliament say, or the religious leaders say, don't use condoms and go ahead and get HIV? Anyway, I'm supposed to have only a last remark, but I go on too long.
It's okay. Okay, thank you very much, Bu Tina, for the insightful situation and explanation about the HIV/AIDS, and thank you very much for your time as well. Okay, so I think that will be all for our today's session. Thank you very much once again, Bu Tina, and I hope that
Okay,
this
terima
event will
kasih.
have, terima kasih banyak. I hope that
Okay.
this event will have a positive impact to all of us. Thank you very much.
Thank you.
Thank you very much. So I will give back to the MC. Thank you from me, Novia Handayani, as the moderator. Thank you very much once again. Wassalamualaikum warahmatullahi wabarakatuh.
We have now reached the end of our visiting lecture. I want to express my sincere gratitude to our esteemed speaker, Mrs. Kritayawan Tinabonto, our moderator, Ibu Novia Handayani, and of course, a big thank you to all of the participants for your active engagement and thoughtful questions. Dear ladies and gentlemen, I would like to remind you to kindly fill in the attendance link shared in the chat box and also check the Drive link periodically as materials will be uploaded there. This has been the visiting lecture, Confronting HIV, Challenges and Strategic Solutions for Effective Response. See you at our next event. Goodbye!
Thank you, Bu Tina. Terima kasih.
Tina.
Terima kasih, Bu Novia.
Terima kasih, Bu Dita.
Terima kasih, Bapak dan Ibu semuanya.
Halo, Assalamualaikum warahmatullahi wabarakatuh. Perkenalkan, nama saya Didi Usada, panggilan Didi, dan saya alumni FKM Undip, jurusan PKIP atau Promosi Kesehatan Angkatan 2006. Saat ini saya bekerja sebagai Humas di PMI Kabupaten Pemalang, dan saya juga MC profesional di Pemalang, Pekalongan, dan sekitarnya. Terima kasih semuanya, salam kenal, Assalamualaikum warahmatullahi wabarakatuh.
Hai, perkenalkan saya Mustika Luciana, FKM Angkatan 2006. Saat ini saya bekerja di Direktorat Kesehatan Usia Produktif dan Lansia Kemenkes dan tengah menjalankan tugas belajar melalui program Euro Public Health.
Perkenalkan, nama saya Fahmi Adimara, FKM Angkatan 2010, saat ini bekerja di PT Arkan Maika Indonesia sebagai Direktur.
Halo, perkenalkan nama saya Tiara. Saya angkatan FKM Undip di tahun 2011 dan saya angkatan 14 MM di Promosi Kesehatan dan saya melanjutkan pendidikan saya di Far Eastern Federal University di negara Rusia dan saya sekarang bekerja di Rumah Sakit Polri.
Ingin sukses seperti mereka? Kamu harus mempunyai kompetensi sebagai berikut. Fasilitasi, advokasi, bina suasana, komunikasi, teknologi media promosi kesehatan, socio-cultural entrepreneurship, social media health content, pemberdayaan masyarakat, need assessment, dan juga edukasi hingga evaluasi program perubahan perilaku. Dari kompetensi-kompetensi tersebut, di PKIP kita akan belajar apa aja ya? Let's check this out. Nah, kita akan belajar di kelas dengan kegiatan diskusi dua arah bersama dosen yang kompeten di bidangnya. Praktikum di laboratorium AFA yang menggunakan peralatan yang canggih dan juga ter-up-to-date, sehingga bisa meningkatkan kompetensi mahasiswa dalam bidang teknologi media promosi kesehatan. Selain itu, kita juga memiliki kegiatan di luar kampus dengan terjun langsung ke masyarakat seperti KKN, KKL, dan juga magang. Ditambah lagi dengan kegiatan mahasiswa seperti GoPro, HP Fest, dan juga kegiatan-kegiatan yang lainnya. Yang lebih membanggakan lagi, tahun 2022 PKIP banyak sekali meraih prestasi loh. Seperti juara 2 lomba video dalam Festival Kreatif Mahasiswa Tingkat Nasional, Gold Medal ICDC dalam rangkaian Tanato Student Research Award, Juara 1 di Nus Potowok ke-7 podcast tingkat nasional. Juara 1 Lomba Penyuluhan Peringatan Hari Kesehatan Nasional dan HIV/AIDS tingkat nasional. Dan juga ikut berkontribusi dalam PSM Undip dan meraih Gold Medal B pada International Brawijaya Choir Festival ke-10. Yuk kenalan dengan pengajar dan juga tenaga pendidik yang ada di bagian PKIP. Ada Ibu Aditya Kosumawati SKM MKes sebagai Ketua Bagian PKIP, Ibu Dr. Gigi Zaro Shaluhia MPH PhD, Bapak Dr. Bagus Wijanarko MPH MA, Bapak Dr. Andes Syamsul Huda Budi Mustafa MKes, Bapak Priyadi Nugraha Prabamurti SKM MKes, Bapak Besar Tirto Husodo Esos MKes, Ibu Rati Indreswari SKM MKes, dan Ibu Novia Handayani SKM MA MKes. PKIP juga dibantu oleh Pranata Laboratorium AFA, yaitu Bapak Teguh Wibowo AMD. Dan juga tenaga kependidikan, yaitu Bapak Ahmad Holil.
Apakah faktanya dosen di PKIP itu galak-galak ya? Bukan, mitos itu. Cerita itu mitos dong. Dan katanya juga nggak deket sama mahasiswa. Salah banget itu. Faktanya, dosen yang ada di PKIP sangat komunikatif dan juga terbuka loh sama mahasiswanya. Gak segan juga untuk mengajak kita berdiskusi bersama. Hubungan antara dosen dan mahasiswanya juga deket tahu.
Iya, bahkan memotivasi mahasiswanya untuk lebih sukses.
Jadinya kita semua lebih semangat deh. Kalau lulusan PKIP hanya bekerja di puskesmas atau pegawai negeri, fakta atau mitos?
Plus mitos. Memiliki kompetensi yang mumpuni di bidang promosi kesehatan justru membuat alumni PKIP banyak berstatus sebagai bidang.
Nah, ada yang bekerja di rumah sakit sebagai konten kreator di bidang kesehatan, industri, LSM, dan bidang lainnya.
Oh gitu. Terus katanya di PKIP nanti kita akan belajar tentang masyarakat lebih dalam. Fakta atau mitos ya?
Pasti fakta kalau ini mah. Betul sekali.
Rancangan intervensi perubahan perilaku yang efektif kan perlu paham masalah dan karakteristik masyarakat masing-masing.
Soal syarat masuk PKIP, emang harus pandai public speaking ya?
Tidak, mitos banget itu. Faktanya, syarat masuk PKIP hanya berdasarkan nilai dan wawancara. Udah, yang penting niat belajar aja. Justru di pemerintahan PKIP, kita banyak berlatih tentang public speaking, jadi jangan khawatir.
Verbal, vokal, dan juga visual akan banyak banget diasah di PKIP loh.
Wow, tapi katanya syarat seleksi PKIP lainnya harus bisa teknologi ini ya? Mitos atau fakta ya?
Itu juga mitos. Faktanya kita di PKIP akan belajar mata kuliah teknologi PKM dan praktikum di laboratorium AFA. Udah, nggak perlu khawatir lagi. Tentunya di PKIP kamu akan meningkatkan kapasitasmu terutama dalam bidang teknologi media promosi kesehatan dan juga akan sangat mendukungmu untuk menguasai segala kompetensi yang ada di bidang promkes tentunya. Jadi, tunggu apa lagi? Ayo bergabung bersama kami di Peminatan Promosi Kesehatan dan Ilmu Perilaku.